Thanks for joining me. Today we're going to be talking about hip pain, what a common problem is. I'm going to give you a test for this, and then I'm going to give you an exercise to fix this, and then I'm going to give you a habit change to fix this too. The hip pain that we're talking about can be any type of hip pain. It can be piriformis pain, it can be bursitis pain, it can be arthritic pain, it can be groin pain. It doesn't matter. It's all usually caused by one problem, and that's something called an anterior femoral glide syndrome. Now what that means is that anterior means forward. So femur or femoral is the thigh bone, and glide syndrome means it's sliding forward. That's exactly what it is. This thigh bone in the hip socket is sliding forward when you're using your legs. It creates an environment for a lot of problems. For instance, you can imagine if it's sliding forward, it's going to be pinching tissues in the front of the hip joint. That leads to groin pain, labral tears, things like that. In the side, we have this IT band that starts up here on the pelvis and comes all the way down to the side of the knee. And underneath that is the bursa that is sits on top of this greater trochanter. If the greater trochanter isn't in the correct place, it's going to rub excessively on that IT band, causing bursitis. In terms of the back of the hip, there's a deep muscle called the piriformis that attaches to this greater trochanter and inserts here to the sacrum. Because it's sliding forward, this piriformis is then overly lengthened and has to work extra hard to try and pull that thing back. We're going to talk about why this pattern is happening in the first place, but generally the piriformis syndrome is being caused by excessive use of the piriformis, not because it's too tight. Why is this pattern happening? Well, typically it's because the butt muscles aren't working. The butt muscles start at the sacrum here and they attach into this greater trochanter. And when we are walking or standing, that butt muscle should be activating to create a pivot point for your hip joint to work. But often this is not occurring. And so the butt muscles shut down, then this starts to get sloppy and cause hip pain. This hip pain can be the cause of a side bending problem, which we talked about in another video. It can also cause back pain. Many health professionals feel that hip pain is coming from the back, but actually what's happening is the hip is causing this pattern to occur, which then causes back pain, and then in the case of sciatica, it will radiate back down the leg again. The assumption is that the sciatica is causing the hip pain, but actually the hip pain is causing everything, which then refers back down the leg. I've just talked about the fact that the anterior femoral glide syndrome is occurring because of poor butt strength. So here's an exercise to correct your butt strength. I call it butt pumps. You're going to get down on your elbows and knees, and you're just simply going to lift your leg up and hold it up there. You're going to find a level where that butt starts turning on. That's the level that you're going to do the pump at. And it's just going to be this tiny little pump up and down for about 20 to 30 repetitions. Then you're going to lower that back down and you're going to raise the other leg. Now, it's really important that you don't lower that leg too far, because if you do, that butt will turn off. And so it'll get some rest in there, and we don't want it to rest. We want it to get strong again. So keep the leg high. Whatever angle you can feel that butt working at is the angle that you want to work at. And you only need to lower it down maybe a ½ inch or an inch when you're doing this. The only thing I want to make sure of is that you're not arching your back excessively to get that leg way up here. The leg doesn't need to be way up here. The leg only needs to be as high as it needs to be for you to feel the butt to turn on. So that's the butt pump. I recommend, again, 20 to 30 repetitions per leg, and do it twice per leg each time you do this. That should get that butt nice and strong and turned on for you. Why is the butt turning off in the first place? Well, it's usually due to your standing and walking pattern. The role of the butt muscle is to control the leg and the pelvis, and therefore the spine, when you're walking. However, most people when they walk are sending their leg out in front of them and having a strong heel strike, which then locks the knee, which then turns off the butt muscles. So we need to test your butt muscles to see whether they're turning on or not. Here's how we do that. You're simply going to put your fingertips on your butt muscles. Now, I don't want the fingertips up here. I don't want them down here. I want them right in the center of your butt cheeks, right there. And you're going to press in. Okay, what you're going to do now is you're going to pinch your butt cheeks together to contract them maximally. And your fingertips should feel that there's a contraction happening in there somewhere. Now, relax your butt muscles again, and this time contract them again and see whether one butt cheek is turning on more or faster than the other. Go ahead and contract them. Feel that contraction. It should feel nice and firm underneath your fingertips, and now relax them again. So they should be completely relaxed right now. Now all you're going to do is you're going to keep your fingertips here on your butt cheeks, and you're going to walk around maybe 10 steps. And what I want you to notice is whether you feel any of that contraction happening when you're walking. Almost all of you watching right now will probably say that they feel no contraction at all. Okay, I'm going to take a break here and ask that you please subscribe, like, and share this video if you find this information useful. I make these videos to help people, and if you know people who are experiencing pain, this kind of information will likely help them a lot. Okay, so we've just determined that your butt muscles are not working when you're walking. Now, how are we going to change that? All right, so what I'm going to ask you to do now is go up on your tippy toes and walk around on your tippy toes for 10 or 15 steps, and you'll notice that your butt cheeks are turning on underneath your fingertips now. It's the butt cheek that you're landing on at foot strike that's turning on underneath your fingertip. This is what should be happening normally when you're walking, which isn't. Okay, so how are we going to change this? Well, all you're going to do, go ahead and walk around again and take about 5 or 10 steps and feel that that butt cheek is starting to turn on. And now slowly lower your heels back down and notice that they're continuing to stay turned on, at least for a few steps. So what you've done is you've temporarily fixed your gait pattern that's turning off these gluteal muscles, and now it's turning them on. So what you will do throughout the day is every time you get up from a chair or anytime you move from one place to another, walk on your tippy toes for 5 to 10 steps to get your butt muscles activated, and it will fix your gait pattern. So what is it about tiptoe walking that's fixing the gait pattern and turning on the butt muscles? Well, there's two things happening. One is that your knees remain unlocked during tiptoe walking. In fact, it's almost impossible to lock your knees. Remember, locking the knees is what's turning off the butt muscles in the first place. The other thing is that it's impossible for your body to lag behind you when you're walking on tiptoes. You'll notice that your body is moving forward with the advancing foot. So these two things, unlocking the knees and letting the body move forward with the advancing foot, are the things that turn on the butt muscles. So you don't even need to do any tiptoe walking. As long as you can remember that and make yourself do that, your butt muscles will start turning on, which will then start correcting the anterior femoral glide syndrome, which will then solve all of your hip, groin, piriformis issues. It's a really simple fix. Now, there could be another thing playing into your hip issue, which is that of something called femoral anteversion and femoral retroversion. And for that, you can watch this video here. If you have back or sciatic pain, I strongly recommend that you watch my free masterclass where I take you through some tests to understand why you're having pain and develop a plan to help you start solving it. Thanks for watching, subscribing, and sharing. Have a great day.